COVID-19 pandemic accelerated the home as a delivery of care model. Now that the pandemic has waned, what will be the lasting impact of the home as a place of care? I'm your host, Carol Flagg, and on this episode, I talk with my good friend Tom Foley, the Chief Growth Officer at GenieMD, who addresses this question and others. Tom also hosts the virtual shift on our own Healthcare Now Radio. Tom's story and career history in healthcare is fascinating. A true health innovator. Take a listen to his journey and hear his views on how healthcare can change for the better for everyone. Well, Tom, welcome to What's My Tagline. I think this has been a long time coming. We finally coordinated our schedule, and it's just great to have you on the show.
Awesome. Thanks for having me here, Carol. Appreciate it.
We've known each other for, I've lost count how many years, but it's been I think a good decade or something in there, right?
At least a decade, exactly.
You're long overdue to be on What's My Tagline.
Hopefully it doesn't take another decade to come back on, but yes.
I know, right? I promise you. You are a busy man, though. And Tom, as you know, of course, before we even start our conversation and probably a little reminiscing as well, every guest I ask on the show, my opening question is, if you had to describe yourself as a tagline, what would it be?
A tagline, personal tagline, I would say thinker, doer, the person that gets things done.
Oh, I like that. You are a thinker and a doer. And
yeah. Sometimes the right brain and the left side of the brain don't ultimately collaborate with each other, but I'm one of those folks that a strategic thinker, innovator, as well as a how to get it done type of guy. So
that describes you perfectly, really. I've known you for so long. Yeah, and that left brain is like the thinking, and the right is total do. Correct?
Yeah. Exactly. So I've been involved in a lot of different innovative things in my career, and as my SVP at Allscripts once described me as he might be the business guy at Allscripts, but I'm still going to give him more things to do because I know he's going to get it done.
Because he's a Swiss Army knife. So again, having known you so long, I know a little bit about your history, which is really kind of fascinating, but really for the benefit of our listening audience, just give us a quick journey of your career in healthcare, which I know touches a lot of big companies. I'd be happy to.
Yeah. So I've been in information technology for 35 years, I hate to say.
Come on now. You started when you were 10.
Yeah, I started when I was 10. Thank you very much. You're so kind.
You were a savant.
So I started at UPS, actually, and it wasn't in the package car vehicle, which I had driven. But people don't know, back in 86, when you called to have a package picked up, everything was handwritten and faxed over to the package car center for that package to be picked up the next day or some future day. So I was the lead systems programmer on automating the 65 telephone centers in the U.S. So that when you called, it was captured electronically. So I'm very familiar at the early age of how to convert a paper system into an electronic system. That led me into another initiative at UPS. So when you sign that clipboard with your signature, I was on the prototype team for that clipboard. And then my responsibility was how to get that information out of the device. And remember, 1990, 91, there wasn't a lot of national wireless data infrastructure in play, right?
It wasn't even the internet, right?
Yeah. So UPS was very innovative in collaborating with the cellular carriers to do something very unique. And then I actually went to a company called Ram Mobile Data. Ram Mobile Data, again, folks might not know, but it was the first wireless data network in the U.S. Oh. Think about that. Just 30 years ago, the first wireless data infrastructure in the U.S. It's now called AT&T Wireless, by the way. It was sold off to Southwest Bell South, and then acquired by AT&T. So So again, another innovative thinking about wireless, and my responsibility was how to. I was responsible for the data network design, as well as the testing of every device that was certified on that particular network. So fast forward, 2000 came around, and I got involved with healthcare. I was consulting with a company, and he was doing some innovative things too. But I read this article about how much paper was in healthcare, and it was kind of a direct match for what my customer was doing. So I suggested to him that he should be offering EHR services to his customers, 40,000 high prescribing physicians at the time. So it led to ultimately an acquisition, and I led. It was of MedComSys and now iPatient Care. They were one of the first platforms to be CC HIT certified. If you remember CC HIT prior to the HITECH Act. So one of the first 13. So stepping in front of the market and saying, hey, we're certified was a big deal for us. And then I got involved in, I was doing my own consulting for about 7 years. In healthcare. Greater New York Hospital Association was one of my larger customers. We were very focused on the transitions of care from hospitals to skilled nursing facilities and things of that nature. So, transitions of care electronically back in 2008, 2009 was not necessarily at the forefront of health IT, but it was very important at that time. So I got involved in, worked at NextGen a bit, worked at Allscripts, rolled out Allscripts direct messaging platform under Meaningful Use Stage 2, and then worked for Anthem and now here at GenieMD. So all along the ways, I've always been involved in some leading edge initiative. I should have said at Allscripts, I was also the product manager for their patient portal. Before they acquired Jar Dogs, but very involved in a lot of innovative things in health IT.
I think it's really sort of interesting. Obviously you have to be in this industry for quite a while to really, I think, understand the big picture of how technology and digital, moving from paper records to electronic. Like people think, oh, the HITECH Act started that, but really, it was really George W. Bush, and then Brailer is the first. He was the first ONC, right? There's this long history, and like anything, you mentioned, UPS and AT&T. Like once the technology is there, it seems like it's this acceleration that goes on, right? If you think about it, it takes forever to get here. And then when it's adopted, the curve goes up, right? Yeah. And now here you are, because innovation is something that you're obviously very interested in. And it's the thing that, keeps you in healthcare and doing what you're doing. And you're in virtual care, GenieMD and remote patient monitoring, all these sorts of things that have been happening, but similar to adoption, COVID has just sort of accelerated all of this, right?
Yeah, it has. And let me just digress for one quick second. I did have, after Allscripts, I did join Lenovo Health and started up the Lenovo Health business unit. And so you think about starting in healthcare, right? When you have just black boxes, but the point there being is, I always say, step on the HIMSS floor and say, where do you start? How do you compete with this, right? So the opportunity was to start defining what the intelligent medical home was looking like. Our focus was really about where the puck was going, not where the puck is, and if you're ultimately looking to be an innovator in the market. So again, just a point in time relative to where my efforts started in the whole virtual care arena was that. And I apologize. So your primary question was?
Well, it was really a more of a comment in the sense that, and I'm going to just go right back to what you just said, that you have always looking for where the puck is going, not where it is. That virtual care, this incredible focus right now didn't start with COVID. It was you were seeing the puck going. Sounds like from your Lenovo days, you were like, this is where the puck is going. This is where the future is, whether it's 5, 10, 15 years or whatever. And now you're here today with GenieMD again, looking for where the puck is going, right?
Yeah. So, let's think about this in context. We would never have been able to respond to the COVID crisis if we didn't do the HITECH Act.
Right.
Think about the providers having access to their patients and with their records being paper or sitting on the wall, and the doctor being at home, right? And the patients not being able to come in. So it's the having information at the tip of your fingertips during the COVID crisis electronically really advanced what we did during COVID, as opposed to. So hats off to Bush and Obama in the context of what Bush started and what Obama accelerated through. And again, another unfortunate time, because that was at the time of the financial crisis.
That's right.
Where the HITECH Act got appended to the equation. So both had vision, both actually contributed to where we are today as a result of our response to COVID.
Yeah, the HITECH Act got tacked onto ARA. Obviously,
exactly.
A really big piece of legislation. Yeah.
Exactly.
So you talk about like stepping on the HIMSS floor and figuring out, where the puck is going. I know that you and GenieMD were at HIMSS this year in Orlando. So I would love to hear your take on that as far as, again, stepping on the floor, where the puck is going. Where is the puck going?
I think we're finally realizing, and again, unfortunate circumstances of COVID drove the transformation, in that realizing that, hey, this piece of technology called telehealth video visits actually works. But I think what's being realized now is that, what happened just before COVID? We had new CPT codes for remote patient monitoring, right? What happened right after COVID in 22 with new CPT codes for remote therapeutic monitoring? And then we also have chronic care management. At the end of the day, where the puck is going is that the home is ultimately being realized as that center of care. And the challenge with that is that getting physicians to realize the value of adopting that home as a center of care, right? Change is very hard in healthcare, and physicians typically say, "Oh, remote patient monitoring. I don't have time or the power to monitor all these alerts," right? What they don't realize is that organizations like GenieMD can help facilitate being that clinical partner in handling all those alerts, and then the doctor being able to engage only those patients that are of that need the greatest clinical care. Meaning, there's been a number of different events with this patient, and there needs to be immediate intervention from a medical provider. So there's additional dollars in the equation, right? So remote telehealth, remote patient monitoring, remote therapeutic monitoring, chronic care management. I talk about this continuous care model, where the providers now are able to go from episodic care to a continuous care model, generate additional revenue, provide greater delivery of care, and the patients can achieve greater outcomes without taking on any risk. Right. So before all this occurred, prior to COVID, it was episodic care to value-based care, take on risk. And the providers had too much, couldn't see their way there. But now, with the continuous care model and these new programs now in place, they can enhance their delivery of care model, provide this continuous care almost 24/7, partner with folks like GenieMD, and generate more revenue, because nothing happens in healthcare unless there's money on the table.
That's correct.
And the patients have a better chance of achieving greater outcomes because they have medical devices, they're being monitored, and a care team is engaging them much more frequently than the little time that they have when they're in that episodic model of a brick and mortar facility.
So back to where the puck is going, you see where the puck is going. You have the innovation. GenieMD is at the forefront of what's happening as far as the home being the center of care. I asked you what your tagline is. What is GenieMD's tagline?
Democratizing healthcare.
And what exactly does that mean?
So democratizing healthcare is about bringing, there's a lot of walls in healthcare.
Silos, right?
And it's controlled unnecessarily. It's controlled by large institutions, or we still have 12 years after the HITECH Act challenges with interoperability, right? And that's a perfect example of why aren't we doing a better job of that, right? It seems like the right thing to do. A lot of people talk about it being the right thing to do, but ask my 84-year-old mother-in-law whether or not she has a consolidated health record, and the answer is no. And democratizing healthcare to some degree is about the collaboration between a healthcare facility and the patient. Oftentimes, people talk about putting the patient at the center of care, and that's really truly what should be. But I think we're still a long ways off in doing that. But ultimately, democratizing healthcare has a lot to do with empowerment of the patient to engage in their care.
Do you think the role of the patient in this democratizing healthcare that you're talking about? How involved does the patient have to be here?
The patient should be very involved. So sit at the table with the family and friends and ask them if they know anything about value-based care.
Right.
So the point is that, and I've done it many times, the point is they don't.
Zero.
So how can a doctor be successful in achieving the tenets of value-based care if the patient doesn't know anything about it, right? And so so value-based care is more of an internal objective, but it could be much easier achieved if the patient was actually aware of the consequences and what the doctor was actually trying to do, right? So how many times we hear the stats all the time. I write a script, never filled. I tell you to diet and exercise, ain't happening, right? So really the change in healthcare doesn't sit with the provider when you're talking to the provider in the brick and mortar. As you've said, I'm the host of the virtual shift, and I often talk about the average Medicare patient. As I reiterated 1,000 times, is that the average Medicare patient with 5 chronic conditions has 9 different doctors, is only in front of the doctors 15 hours in a given year. The issue here, if we're really going to reimagine the delivery of care and we're going to change outcomes, is what happens in the 8,745 hours that the patient is not in front of their doctor. Awareness occurs in front of the doctor. Wellness occurs at home. And the patient has to be empowered to achieve that and coached to do that. You can't give a script that says diet and exercise and stop eating that jelly donut and expect them in that long duration of time to actually change their behaviors. They need continuous care in that they know that they can go to somebody when they need help to help them move past where they're at, right? It's, again, I use my father as an example. He was a diabetic, so I know the situation all too well. My mom converted the dining room into a bedroom, installed a full bath downstairs in a house. Diabetes does not hurt until, the repercussions start to come, right? You go on dialysis at home, you have an amputation, another amputation, a third amputation, and a fourth amputation of a couple fingers. It hurts. And so therefore, you really need to look at not just, hey, you got diabetes.
Right.
As often people think about diabetes as I got diabetes type 2, I'm going to die with diabetes type 2. That's not true. You can put diabetes in remission, and you can get rid of it, and you don't have to look any further than the old show, The Biggest Loser, where they walk into a facility and they have a bag of pills and they have all kinds of conditions, and 60, 90 days later, they've lost a tremendous amount of weight, all supervised by physicians, by the way, but they've lost a tremendous amount of weight, but their bag of pills is empty because they got rid of diabetes, because they diet, exercise, and they're eating the right things.
Right.
Healthcare transformation lies with the consumer.
Right.
A physician, and my physician friends always get upset when I say this, but a physician cannot heal you. A surgeon can, but a physician can only advise you. You have diabetes, and this is what you should do, right? And then the healthcare system that we have today just monitors you to make sure your glucose level is in balance. It doesn't help you get rid of diabetes,
right?
Because the real problem is that you may be eating too much. You're not exercising, right? So there's a lot of different things that we can do. It's not about going to a doctor and getting a pill prescribed, which typically is the case, right? It's going to the doctor and getting a care plan prescribed that gets you off the pill.
Right.
Right. It's a huge transformation. I'm sorry. Go ahead.
Yeah, no, go ahead. I was going to say, what you're talking about really in where the home is the center for care really wraps all that in, right? It's not just about being well, is not just about going to a doctor and taking, you now have high blood pressure medicine or, type 2 diabetes, or, it could be any number of chronic conditions that some of them not so serious, some very serious, right? Yeah. But it's more than that, right?
Yeah, exactly. So, it's, and even in the home, it's not just about the provider team providing this continuous care model where the patient has access, but think about this, I always, again, use my parents and my mother-in-law and father-in-law as examples. You need an advocate. A lot of people don't have advocates, and therefore they fall through the cracks. As well as, a doctor says diet and exercise, but I don't have access to good food because I am in a geography that poverty is the norm, and it has been the norm for decades. I don't have access to good food. I don't really have the and I don't have access to, how do I best exercise? It could be just taking a walk, but some neighborhoods aren't safe to walk. So the point there being is the ability to change how we think about achieving better degrees of wellness has to be all-encompassing, right? Technology in and of itself as well, a home becoming the center of care. I need access to technology. Do I have, I am, not me personally, but but the challenge in urban America and rural America is, I want to get well, but I don't have the support team and I don't have the finances to ultimately achieve the desired plan that my physician prescribed. And that, and the home ultimately is really the fusion of a couple elements. You have certainly your brick and mortar facility fused with virtual care, fused with social determinants of health and lifestyle. So your care plan has to have some level of consideration of all the above in order for that patient to really have an opportune chance to achieve the desires of wellness that are necessary.
Yeah. It's so easy to say, well, just buy organic food and get a gym membership. Yeah. Right? For so many people, that is completely unrealistic when we live in a society where bad food is cheap and good food is not.
Yeah.
It's
It's really concerning. And so the people, even in healthcare, I think only two things happen when we do healthcare reform. And those two things are provider gets paid less and the consumer pays more. I hate to say, so even with the Obamacare, if you will, it provided greater access. That is true. And you had more folks register for care, but my ability to afford the copays is still the inhibitor to care. Right. So I'm not dissing Obamacare, by the way. Right. I'm not at all. Whatever works. But I don't think we look at care the way we don't look at the bigger picture around care. We don't look at in order to reform healthcare, I think you need to reform education, frankly. And in order to reform education, I think you need to have a reform of an economic reform because these communities need to thrive. How do you thrive? How do you thrive in a community? You have jobs, and if you have jobs, you have money. If you have money, you have access. So the dominoes are bigger than just, geez, how do we? Bigger than value-based care. Right. The social determinants of health are the influencers, and if you're not going to have a plan that addresses those dynamics, then we're just throwing a lot of money at a problem, but we're never ultimately going to fix it.
Yeah. How do we make healthcare a holistic approach for the whole country, for everyone? Right.
Yeah.
So as we wind down our conversation, I would love to spend a couple minutes talking about the virtual shift, which, as I say in my intro, is a radio show on our network, and you are the host, of course. And you're just celebrating your 1-year anniversary with the virtual shift as host and going into season 2. So tell our audience a little bit about, you already have, but give a little bit more insight as to the kind of conversations you like to have on the virtual shift, and maybe give us a peek into what's coming our way for season 2.
Yeah, so the virtual shift is about the shift in the market. It's really about the reimagining of the delivery of care. And so, who are the shifters, if you will, all right? So who has the innovation? Who's driving? And the opportunity for the virtual shift is to create a collaborative. And that collaborative is about everybody participating. Certainly being listeners, having grown to an audience of 8,000 within a year of monthly listeners is awesome. But season 2 is really about lifting those listeners to be collaborators, if you will.
Oh,
so you'll find in season 2, I'm going to try and be more engaging into the real problems of care. It's all, it is all about the virtual shift, but how do we achieve it? Not just for those that can afford it, but those that can't afford it. How do we bring true the reimagination of the care so everybody has access, regardless of financials, regardless of color, regardless of the geography that you live in? Healthcare is, if we all want a healthy tomorrow, then we all have to have access and be participants in how we change the way in which we eat, diet and exercise, and engage in our own wellness, because we are the ones, we are the ones empowered to do that on our own. And the more we do that, the less burden that we put on the healthcare system in and of itself.
Yeah. Tom, thank you so much for your time today. It was obviously always great talking with you. And I look forward to season 2 and seeing you in person sometime this year.
Awesome. Thank you, Carol. Appreciate it.
You can learn more about Tom Foley by connecting with him on LinkedIn or on his show's program page on healthcarenowradio.com. And be sure to check out his company at GenieMD.com. You can learn more about this show on the program page at Healthcare Now Radio. Be sure to follow me on Twitter at Carol Flagg or on LinkedIn. Have a topic or a guest idea for this show? Send me an email to carol@healthcarenowradio.com. Till next time, I want to know, what's your tagline?